Interlock my fingers, press my thigh towards my torso, and I'll create compression around the right side of my torso. So right side I have bigger size of my lungs, right side I have liver, gallbladder, right side kidney, right side of large intestine, small intestine, and on right side I also have appendix that helps in proper functioning of your good bacteria. So enjoy that compression, and right side you have head of your pancreas, so that will also get benefited. Then slowly lift your head off the floor, touch your nose to the knee. Enjoy the compression. Come back. Drop your hands down. Lift your leg, drop it down. So this is the first and easy variation of wind relieving pose. As I already told you, when you lift your legs off the floor, create compression around your torso, which all organs will get benefited. And when all these organs will get benefited, whatever the function they are responsible for, that function will also get smoother. So this is the way wind relieving pose is going to help in so many ways. Now we'll go to the complete wind relieving pose, the final position of wind relieving pose. So here what we'll do, we'll lift both legs off the floor. This is called Dvipaduttanasana. Then we'll bend both knees together. We'll press both knees together to the torso. Then I'll interlock my fingers, cover my shin bone, and press my both knees to my torso. And then with breathe out, slowly lift my head and place my nose between two knees. This is called complete wind relieving pose. And let me tell you, when you are pressing your knees towards your torso, you are squeezing your abdominal area. In gym, people call it crunch. Crunch means when you squeeze your abdominal muscles. The people who want to get six pack abs or eight pack abs, they do crunches in the gym. The same thing you are doing, you are crunching your abdominal area. Crunching means you are contracting your abdominal area. In yoga language, it is called centralization of energy. How Pavan Muktasana, wind relieving pose, is going to help you in digestion? Cause you are creating compression around your abdominal area, you are crunching your abdominal area. This way you are centralizing the energy of your body towards your abdominal area, and this centralization will help your body to smoothen the digestive system. So the same thing happens when you eat meal. Like when you take food, that food through esophagus goes in a belly bag, and when it enters in into the belly bag, the message goes to the brain. Then now it's time to churn that undigested meal, and that the process of churning starts. Unless the process of churning gets completed, the whole body's blood circulation is mostly centralized towards your belly bag. This is called centralization of blood circulation. That's why when you overeat, you feel drowsy, you feel sleepy. Why? Because the blood circulation around your head, blood circulation around your legs and hands area is less as compared to the blood circulation around the abdominal area. And once the digestion is done, after 45 minutes and 50 minutes of having meal, then the body becomes relaxed, and then it decentralizes the blood circulation to the other part of the body, and this way you feel normal. This is one of the reasons that you should not do overeating, because if you will do overeating, the blood circulation will mostly centralize towards your abdominal area, and you will feel drowsy, lazy, you will feel down in energy. Back to the asana. When you are contracting your knees towards your abdominal area, and you are pressing your knees with the help of your hands towards your chest, you are contracting your abdominal area, you are centralizing the energy, you are sending message to your brain that yes, it's time to centralize the energy. And this way, when you regularly practice wind relieving pose, the capacity of your brain and body to centralize the blood circulation and energy towards the abdominal area becomes sharpened and better, and this way your digestion improves. So this is the way you can say that wind relieving pose helps in indigestion, gastric acidity. And one more thing, as per Ayurveda, this area, this abdominal area, is dominated by Saman Vayu. Saman Vayu is responsible for assimilation and digestion. So when you are contracting your abdominal area, you are also helping your body to regulate Saman Vayu. If Saman Vayu is regulated, two other Vayus, Apan Vayu below the pelvic floor and Udan Vayu above the chest will also get regulated. And this way your digestion becomes smoother, your air circulation, blood circulation gets smoother. So many benefits by just doing one simple wind relieving pose. So these are the benefits, and I showed you how to perform wind relieving pose. Precautions. If you have back pain, avoid it. If you have hiatal hernia, avoid it. Consult with the doctor. And if you have gone through any operation, any surgery in last 5 to 6 months, then it depends on doctor's prescription if you should go for the asanas like wind relieving pose. And if you have a lot of fat around your abdominal area, in that case, keep it easy. Yes, let me tell you, if you feel that you are not that flexible to press your knee towards your belly, if you have a lot of fat around your belly, then in that case, what you can do, you can go one step back. So rather than creating grip around your shin bone, you can just lift your knee and you can create easy grip around your hamstring, and then you can try if you can press it. So keep it easy. The same thing you can do from other side like this. And even if you are doing Sampurna Pawan Muktasana, complete wind relieving pose, then you can do this. It will also help you to release the unwanted air, that is called Apan Vayu, from your body. So this is what you can do if you are obese or if your BMI is high. If you have soreness around the lower part of your body, it can help you to come out of that soreness. If you have any medical condition that I'm unable to mention, you can drop me the question and I can answer you if you can do the wind relieving pose or not. So these are the benefits of wind relieving pose with the precautions. Flexibility, yes, it will help you to increase flexibility of your hip muscles, hamstring, knee joints, and lower back. And when it's about a strength, it will strengthen your abdominal area by crunching it, by centralizing the energy. When it's about weight shifting, yes, you are shifting your whole body weight towards your abdominal area, and this weight shifting can help you to improve your digestion. And when it's about body beautification, if you practice wind relieving pose on regular basis and you have very minimal fat around your abdominal area and you are apple shape, practicing wind relieving pose on regular basis can help you to get rid of that apple shape and to go towards the V-shaped body, that is called a well-defined body shape. So these are the different benefits of wind relieving pose. Practice it on regular basis and get best benefits out of it. Let's move to the another asana. The next asana that we are going to perform is one of the most famous asanas in the world at present era. It is called plank pose. In Sanskrit, we call it Halakasana. Plank pose is strength-based asana. If you want to get best benefits from plank pose, you should make it part of Hatha Yoga. Now, let me tell you how you can practice plank pose and how you can make part of Hatha Yoga and get best benefits out of it. So before that, let me show you how you can go to the plank pose. So there are two ways you can go to the plank pose. If you feel that you are physically very strong and tough, then from prone position you can go to the plank pose. Let me show you how you can go to the prone position. So what is prone position? When you lie down on your belly. This is called relaxing in prone position. So before you go to the prone position, what you have to do, you have to check your nasal. Whichever nasal is active, like in my case, left nasal is active, so I'll turn my head left side and then lie down on the floor for some time like this. This is called relaxing on prone position. Why should I check my nasal and turn it to that side which nasal is active? It is to regulate heat and cold in my body. We have the earth that pulls everything towards the gravity. Like in my case, left nasal is active, so I'm turning my head towards the left. So left is up, right is down. So when right will be close to the earth, it will experience more gravity as compared to the left. So this way, the heat and cold balance will automatically get regulated in the body. What a magical thing. That's why whenever you are going on prone position, you have to check your nasal first, and then according to that, you have to rest on the prone position. Just lying down on a prone position can help you so many ways, because right now your heart is compressing your rib cage, so the gap between the left side of your lungs and your heart gets created, and that gap helps your lungs and your heart to expand and contract properly, and this way it helps in proper supply of oxygen and blood. So this way, lying on prone position can help you in blood circulation and proper supply of oxygen. That's why before putting any patient on ventilator, doctor make the patient lie down on the prone position and check if the person can survive. If the person can survive, then there is no need of ventilator. But if person cannot survive, then the patient is put on the ventilator. So this is the importance of prone position. So let's again go back to the prone position. I'll stay here and do some breathing. But precaution, if you have a lot of fat around abdominal area, if you are obese, then lying down on prone position can make you feel suffocated. Why? Because your abdominal area will create pressure towards your heart and lungs, and you may feel puked, you may feel suffocated, or you may feel giddiness. So in that case, don't lie down on prone position if you are feeling uncomfortable. But if you are fit and if you feel that lying down on prone position is not that tough for you, then enjoy that posture. So if you want to go to the plank from prone position, then stretch your both hands over the head. Place your forehead on the floor. Make sure that your nose should not touch the floor. Why? So that you can engage your cervical area and you can make it ready for handling the weight of your head. Then slowly pull your both hands by the side of your chest. Stretch your toes in dorsiflexion. Pull your body up and plank. You can correct your plank. This is the plank. This is the way you can go to the plank. But if you are not that physically strong, you are a beginner, you are new, then we have another way to perform plank. For that, what you have to do, you have to take help of Marjariasana, cat pose. So for that, you will just place your both hands on the floor like this, and then you have to create the gap between your both hands equivalent to the width of your shoulders. So if you look at your gap between your hands from the floor, it should look like this: neither beyond the shoulder line, nor beneath the shoulder line, nor above, nor behind the shoulder line. It should be an exact shoulder line like this. The gap between your both hands should be equivalent to the width of your shoulder. So it should look like this from beneath. So this is the gap between your hands. The same gap you have to make between your knees, and you also have to check that your knees should make 90-degree angle. And then you have to stretch your toes in, keeping your both hands vertical to the floor. You have to stretch your one leg back and then the leg back, and this way you can go to the plank. Easy. So if you are physically strong, push your body up from prone position to the plank. If you are a beginner, you are not that physically strong, then you can go from cat pose to the plank. Now, Hatha Yoga theory. The postures like plank will not benefit you unless you set them with target. Like holding plank for 2 minutes, 3 minutes can be beneficial, but holding plank 10 seconds, 20 seconds will not benefit you that much. This is the drawback of plank. Why? cause to circulate your blood head to toe, to build up a rhythm and synchronization between your one bone to another bone, one muscle to another muscle, one body part to another body part on plank, it needs time. That's why holding plank for a long can help you to get best benefits out of it. The benefit of plank is it tones your muscles, it strengthens your bones, it makes your joints stronger. It works on your cartilages, it works on your tendon, it works on your ligaments, it helps you to tone your core, it helps you to increase density of your bone. So now let's go for the plank pose. Let's apply Hatha Yoga, means holding it for a long, and let's see what happens. So I'll go to the cat pose and then I'll go to the plank, hold it. Now I'll hold it as long as possible, and by the time when I'm holding it, I'll also help you with the benefits and the precautions you have to take when you are performing plank. As per Ayurveda, if you are Vat dominated means if you have any problem related to your joints, if you have any problem related to your bones, like you have fragile bones, you have osteoporosis, osteoarthritis, knee pain, back pain, tennis elbow, then in that case, plank can help you a lot to strengthen your joints and to increase the bone density of yours. Except that it synchronizes all your muscles, all your bones, all your joints with one another. And if you hold your plank properly, it can also make your body beautiful. It works on the aspect of body beautification, and it is a strength based asana. It can strengthen all your bones, joints, and muscles. Here you can see that my both palms are flat on the floor, so all the acupressure points on my palms are getting pressurized. So all these acupressure points are some or other ways connected to all the organs inside my body, so those organs will get massage. Around my both wrist we have radial artery. That radial artery will get pressurized and it will get pumped to the heart, so it is good for heart. And because it is some or other way similar to the prone position, so it is good for blood circulation and respiratory system. Hold it for a long, face the pain, and enjoy it. And then slowly come back. This is called Phalakasana, plank pose. Precautions: if you have knee pain, ankle pain, tennis elbow, hiatal hernia, sciatica, varicose vein, in high blood pressure, don't hold it for long, hold it for moderate level. And I always say that if you are a woman or you are a pregnant, doing asanas like plank pose, you have to be extra aware, because if you are on a second or third trimester of your pregnancy and you're holding a plank, or may not it be, if you lose your balance, it may create problem for you. So from second trimester onwards, avoid plank pose. And if you recently had any bypass surgery, that in that case, avoid it. There should be at least 8 months to a year gap once you are done with the bypass surgery and then performing asanas like plank pose. And if you are short tempered and if you are on your menses, avoid plank pose, because plank pose increases the blood circulation. It can swing your mood and it can create anger issues. These are some aspects where you can be extra alert before performing plank pose. Strength, yes, it can strengthen all your joints, all your bones, all your muscles. Body beautification, it will help you to make your body beautiful, because you are aligning your left body part with right one, your upper body with lower body. One more thing, because when you are on a plank, you are keeping your head on air with the strength of your cervical area, so it will also strengthen your neck muscles. So if you really want a manly look, so you should have a massive neck size, so it will help you to have that size and give you a manly look. If you have any medical condition, you can write it down to me and I'll check if you should do plank pose or not. So practice plank pose, apply Hatha Yoga on it and get best benefits out of it. And let me tell you once again, holding plank for 10 seconds, 20 seconds, 10 times won't help you much. But holding plank for 3 minutes, 4 minutes, 5 minutes will help you a lot. The longer the time period of holding the plank will be, the better and the more beneficial it will be. Rather than trying 10 times for a short span of time, try it for a long time, give it a target and do it. Let's move to the another asana.